Okay, to start my health assessment, I am going to start by performing hand hygiene through washing my hands with soap and water for a minimum of 30 seconds. So I'm going to go ahead and do that. Alright, now that I've done that, I'm going to introduce myself to the patient. Hi, my name is Madison and I'm going to be performing a health assessment on you today. Could you tell me your name and what you would like me to call you?
My name is Logan Stacey and you can just call me Logan.
Okay, and like I said, we're going to be doing a physical assessment today, okay, Logan?
Alright.
Alright, so I'm going to begin by simulating the assessment of your vital signs. And Logan's temperature is 98.7, his heart rate is 82, his respirations are 16, and his pulse ox is 99, and his blood pressure is 124/86. Okay, Logan, are you experiencing any pain today?
No, ma'am.
Could you rate your pain on a scale from 0 to 10, with 0 being no pain at all and 10 being the worst pain you've ever experienced?
0.
Okay. And Logan, can you tell me about what time it is?
About 1 o'clock.
Okay. Can you tell me where you are?
I'm in the hospital.
Okay, and can you tell me who I am?
You're my nurse.
And what about who you are?
My name is Logan.
Okay, and now tell me what we are doing today.
We're doing a health assessment.
Perfect.
Checkup.
Okay, so the patient's mood appears to be rather calm and flat, and he is AAO times 4, meaning that he is oriented to person, place, time, and situation. So that all looks good. So now, Logan, I'm going to inspect the skin in each area for uniformity. So I'm going to start up top, and I would look at the patient's chest and abdominal region as well. Now moving on to Logan's legs, and let's assess for the uniformity of his feet. Okay, so the patient doesn't appear to have any type of skin lesions or tattoos. And moving on, I'm also going to palpate the skin for any type of excess dryness, moisture, unseen lumps. And I'm going to compare the temperatures bilaterally using the back of my hands. So going down bilaterally again with the back of my hands. See? Okay, so the patient does not have any excess dryness as the skin is rather soft and moist, and he doesn't seem to have any lumps or tenderness. Were you experiencing any kind of tenderness or pain during that, Logan?
No.
Okay, perfect. And in addition, the temperature of both his upper and lower extremities was warm and consistent bilaterally. So now, Logan, I'm going to assess the color of your nails, the beds, as well as the tissues around them through palpating the texture of your nails. All right, let's see your toes. Okay. And now we'll look at the other ones. Perfect. Okay, so the patient's nails are convex, trimmed, and translucent, and there was no presence of any type of clubbing on the fingernails or the toenails. And I'm now going to assess your peripheral vascular area by checking the capillary refill on both your hands and your feet. Okay, so that was the capillary refill of the upper extremities, and it was less than 3 seconds bilaterally. Now moving on to the lower extremities. Okay, so the capillary refill of Logan's lower extremities was also less than 3 seconds bilaterally. So now, Logan, moving on to your head and neck region, I'm going to assess the size, shape, and symmetry of your skull and your scalp, and I'm going to do that by palpating, if that's okay with you.
That's okay.
Okay, so the patient's head is normocephalic and free from lesions, and his hair is evenly distributed, and it is thick and dry, but not oily, and it is free from parasites. So moving on, I'm now going to assess the skin of your face and for uniformity as well. So I'm going to look at your skin all around. Okay, So the face is uniform in color without lesions, and it is symmetrical with the eyes in the upper third of the face and the nose midline, and the mouth is in the lower third of the face. So now, Logan, I'm going to assess the symmetry of your neck. So let me just look at your neck, and I'm going to palpate to feel. So the patient's neck is also symmetrical, and I am also going to palpate the carotid arteries at one at a time. So palpate one. Okay, and now I'm going to use my stethoscope to auscultate the carotid arteries with the bell. And while I do this, I want you to hold your breath, okay? So as soon as I place my stethoscope, you can begin holding your breath.
Okay.
Okay, so Logan's carotid pulses are strong, equal, and they have a regular rhythm without any bruits bilaterally. So now I'm going to palpate the location of all of your lymph nodes. Okay, it seems that all lymph nodes are palpable. And moving on to your eyes, Logan, I'm going to assess the structure, the sclera, the conjunctiva, and the pupils. And I'm going to do that by shining my pen light in your eyes, okay? So open up. Great. So the pupils are equal, round, reactive to light accommodation. And if I were to use an ophthalmoscope to assess the eyes in this situation, I would assess the optic disc, the size, the color, the cup disc ratio, the margins for hemorrhage, new vessels, and collaterals, but we're not going to do that today. And moving on, Logan, I'm going to again use my pen light to assess your ears for any type of piercings or drainage, but also for symmetry, elasticity, tenderness over your auricle, tragus, and mastoid process. Okay, great. Logan's ears appear to be symmetrical. He doesn't have any piercings or drainage or lesions. The temperature was warm bilaterally. And like I said, there's no lesions or tenderness, and the ears are elastic. So now that I have also used my pen light, I have also inspected the outer ear canal for foreign bodies and cerumen. And what I've found is that there are no foreign bodies in Logan's ears, and there's a small amount of cerumen, which would be normal. And if I were to use an otoscope to complete this auditory assessment, then I would assess the condition of the external auditory canal, the tympanic membrane, and the middle ear. But we're not going to do that today. So moving on to your nose, Logan, I am going to inspect to see if it is midline on the face and assess for deviation. Okay, Logan's nose is midline without any type of deviation. And I'm now going to assess the patency of your nares, Logan. So I want you to take one finger, put it on your nostril, hold it down, and breathe in. Okay, now do the other side. Okay, thank you. So both of Logan's nares are patent, as we'd like to see. And I'm now going to use my pen light to inspect the septum for deviation. All right, Logan's septum is not deviated. And I am going to palpate the frontal and maxillary sinuses now. And let's go ahead and do that. So upon palpation, there appears to not be any tenderness present, which is great. And Logan, I'm also going to assess your lips for any type of symmetry, color, moisture, cracking, or lesions. Okay, so Logan's lips are symmetrical, pink and moist, and they do not have any type of cracking or lesions. So moving on, with my pen light, I am now going to look inside your mouth to assess your buccal mucosa, your teeth, your gingiva, hard and soft palate, and your pharynx. So open up. The Thank you. Okay, so Logan's tonsils are present and pink without swelling or exudate, and they are +1. And in addition, the uvula is midline, And upon assessment of the dorsal surface of the tongue, it is pink, moist, hard, and roughened. and the central surface is smooth and glistening with veins, just as we would want it to be. So now, Logan, I'm going to inspect your anterior thorax by palpating the front of your chest. Okay, and could you sit up for me so I can palpate the back of your chest? Okay, perfect. So now I'm going to assess the skin turgor under your clavicle as I did with your fingers and toes by giving you a small little pinch on your chest, okay?
Okay.
And you can go ahead and sit on that for me. Okay, the capillary refill is less than 3 seconds, so great again. And also through assessing the anterior and posterior thorax, I am able to find that Logan's transverse diameter is 1 to 2. And I'm sorry, I'm going to have you sit up for me one more time to assess your posterior side. So upon assessment, I have found that the spine is midline and there are no lumps, pain, or tactical fremitus. And the chest appears to be symmetrical on expansion. Thank you, Logan. And now, Logan, I'm going to percuss your lungs in 10 different areas using the side-to-side technique. And while I do this, I just want you to tell me if you're experiencing any type of tenderness, okay? So I'm going to do this in 10 different spots. Doing great. Okay. I'm now going to auscultate your anterior chest in 10 areas using the side-to-side technique. And while I do so, I want you to breathe through your mouth a little bit faster than normal, okay? Okay, so the vesicular sounds are present in the peripheral lungs fields, and there are no adventitious breath sounds. And Logan, I'm going to have you sit up for me one more time so I can auscultate your posterior chest in 10 areas using this side-to-side technique. And while I do this, I want you to breathe through your mouth a little bit deeper than you normally would, okay? Okay? The vesicular sounds are present in the peripheral lung fields. And while sitting up, I've already auscultated your lung sounds in 2 places bilaterally, and Logan's lung sounds have been found to be clear bilaterally. So moving on to your cardiovascular system, I will now assess the skin over the pericardium. So lay on back for me. And this is the heart and the lower chest region. And if Logan were in the hospital setting, he would have on a gown and it would be much easier to assess his skin. But I'm going to now assess the skin area around the skin of the heart. And there are no pulsations, lifts, or heaves visible over the pericardium. So now I will identify the second intercostal space, which is located at the right sternal border. And this is where the aortic valve is placed. So this would be located right about here in this region. So now I will identify the second intercostal space, which I have done that right here at the left sternal border. So moving on to the Erb's point, which is the third intercostal space. It is near the left side of the sternum, and it is on the left lower sternal border. So that would be moving down just a little bit into the side, which would be about right here. So the tricuspid is the fifth intercostal space, and it is located between the 2 right chambers of the heart, which would be close to over here. So I'm now going to use my stethoscope, Logan, to listen to your apical pulse for 1 full minute, okay?
All right.
And I am going to palpate and auscultate with the diaphragm of my stethoscope and then the bell. Alright, now that it's been a full minute, I have found that Logan's apical pulse rate is 72 and the rhythm is regular with no extra sounds or murmurs or anything like that. So now this time I've completed my cardiovascular assessment and I'm going to move on to an abdominal assessment. And I'm going to start that by looking at the skin on Logan's abdomen. And again, if he had on a gown in a hospital, I would be able to see the skin a little bit better. But for today's purposes, I'm going to simulate looking at the skin on Logan's abdomen, and I'm looking for hair, scars, piercing, striae, vascularity, rash, lesions, or contour. And what I've found that the skin is smooth and dry and even in temperature with minimal hair, no scarring, no scarring, piercing, striae, rash, vascularity, lesions, or contour, or anything like that. And at this time, I would have also assessed your umbilicus. And Logan's umbilicus is midline and inverted without any peristalsis or pulsations. And I'm now going to use my stethoscope again to auscultate your bowel sounds in all 4 quadrants, starting from the right lower quadrant, okay? Alright, so Logan's bowel sounds are present and hyperactive in all 4 quadrants. And now I am going to palpate the 4 quadrants. So the major organs in the right lower quadrant include the cecum, the appendix, part of the small intestine, the right reproductive organs, and if Logan were a female, it would be the right ureter would be there as well. And the major organs in the left lower quadrant include the small intestine, the large intestine, the reproductive organs, rectum, left ureter, and left iliac fossa. And the major organs in the right upper quadrant include the liver, pancreas, gallbladder, duodenum, upper portion of the right kidney, and part of the colon. And moving on to your last quadrant, which would be the left lower quadrant. This includes the stomach, spleen, left lower lobe of the liver, body and tail of the pancreas, left kidney, and suprarenal gland, and the left half of the transverse colon. So now I'm going to inspect your arms, hands, legs, and feet for skin integrity, temperature, color, symmetry, and hair distribution. So going down again, onto the legs, and I will look at your feet one more time. Okay, and what I've found is that the skin of the arms, hands, legs, and feet are intact, and they all have a pretty even temperature, and there's an even color with equal hair distribution bilaterally. So now, Logan, I'm going to assess the radial pulses at the same time for comparison of the rate and rhythm. And your radial pulses are located right about here on your wrist. So Logan's radial pulses are +2 with a normal rhythm. And now I will assess your brachial pulses bilaterally for comparison of rate and rhythm, which are here in about the crease of your elbow. So the brachial pulses are also +2 with a normal rhythm. So moving on to your posterior tibial pulses inside of your ankle. Okay, Logan's posterior tibial pulses are also +2 with a normal ripple. And at this time, I'm going to check the capillary refills of your fingers and toenails if I haven't already, but I have already done that, and as we found, they were less than 3 seconds bilaterally. And to finish off my assessment, Logan, I am going to assess for edema through palpating from the knee down to the tibia to the ankle. So I'm going to assess for any type of swelling is what I'm looking for right now, okay?
Okay.
All right, there's no edema to note in this area, and that completes my physical assessment. Do you have any questions, Logan?
No, ma'am.
All
Thank you.
right, thank you.